A PSA test is a simple blood test that can help check for prostate cancer. Prostate cancer is the most common cancer in men in the UK, and it can affect anyone with a prostate. Who should consider a PSA test? A PSA test can be offered to those at a higher risk of prostate cancer. You may be at a higher risk if you are over 50, have a father or brother with prostate cancer, or are of black ethnicity. You might also be offered a PSA test based on your personal symptoms. However, a PSA test might not be right for you depending on your general health or fitness level. What is the PSA test? A PSA test checks the levels of a protein called prostate-specific antigen, or PSA. A high PSA level doesn't always mean cancer. It could be down to other factors such as your age, a urine infection, recent ejaculation, or vigorous exercise. Before you consider a PSA test, it's important to understand the advantages and disadvantages. The benefit of a PSA test. A PSA test can help find prostate cancer early, even before you have any symptoms. Finding cancer early makes it much more treatable. If the test shows you have a low PSA level, this can also put your mind at ease. Issues with the PSA test. Just like any other test, a PSA test isn't perfect. Sometimes it may give a false alarm and say there's a problem when there isn't. The PSA test can also miss some cancers. And some prostate cancers grow so slowly that they would never cause harm. Finding these cancers may lead to treatment that you didn't need. What happens if you have a high PSA result? If a high PSA level is found, it often means more tests, such as an MRI scan or a prostate biopsy. These tests can have side effects, so it's important to discuss them with your doctor or specialist. If you have any questions or you're just worried, speak to your GP or specialist. They can help you decide.